Hello and welcome to today's webinar, Human Service Power Brokers Using ARPA to Drive Racial Economic Equity in Memphis, Detroit, and Beyond. We're going to give folks a minute or two to join just so that everybody can trickle in from their last meetings. We hope you're having a great day today, and thank you for joining on today's webinar. Hello and welcome again to today's webinar, Human Service Power Brokers Using ARPA to Drive Racial Economic Equity in Memphis, Detroit, and Beyond. Welcome to today's webinar. Today we'll be discussing, on today's agenda, we'll be discussing welcome and housekeeping, practitioners panel, and then we'll have a group discussion and Q&A, and we'll finish off with next steps and close. Just so you know, this webinar is being recorded and will be mailed to registrants and available online within 1 week. All webinar attendees are muted to ensure sound quality. If you want to ask a question or share your thoughts at any time, please type into the text box of your GoToWebinar control panel. And as always, if you're experiencing any technical issues, email gotomeeting@prosperitynow.org. To get the most out of today's call, we invite you to join from a quiet space. Grab a coffee or a snack and settle in. Engage, send us your questions and comments as you listen, and reflect on ways to apply what you learned today to your own work. Prosperity Now's mission is to ensure everyone in our country has a clear path to financial stability, wealth, and prosperity. Before we start today's webinar, we would like to extend a welcome to our sponsor and have a word from her. Here today with us is Joelle Jude Fontaine, Program Manager of the Kresge Foundation.
Good afternoon, everyone, and thank you for making the time to join us. We here at the Kresge Foundation and the Human Service team are really happy to have this opportunity to co-host this webinar with our grantee partner, Prosperity Now. And before I kick it off to our partners, I just wanted to say a few things about why this investment is important for us. I think the first thing is that one of our North Stars really around social and economic mobility and security. We feel that there's nothing perhaps more powerful than intergenerational wealth creation in terms of ensuring that families remain thriving over generations and over time. And so that's why we thought it was really important to invest in this. Part of the way that families are able to do this is certainly through their efforts, but also through the policies and the support systems that we have in place as a society in order to help families reach those goals. And so for us, this investment is critically important because what we're doing with this investment is that Prosperity Now is working with two of our priority cities, Detroit and Memphis. They're working with organizations to help them to identify the policy barriers that they feel that their participants are facing and help to identify potential innovations and solutions that can help dismantle these barriers and really help people get to social and economic mobility and security, but most importantly, to ensure that it's long lasting, that it does transfer from one generation to the next. And so really happy to be here today. And without any further ado, I'm going to pass it on to Kat, who will give you a little bit more information about the day.
Great, thank you, Joelle. Sincere appreciation to you and the Kresge Foundation for making this trailblazing work possible. We're really excited for you all to join us today for this important conversation and thinking about how 7 high-impact organizations in Memphis and Detroit are leveraging this auspicious moment, the pandemic, the racial reckoning, and the American Rescue Plan Act, or ARPA, funding to put money in the pockets of the people. They're all launching innovative racial economic equity policy advocacy pilots. You can read more about that in the materials that we've uploaded, the project summary. And today we'll be joined with 3 of our human service power broker leaders about how they and their cohort are collectively targeting $73.5 million of the federal American Rescue Plan dollars committed by the Biden administration 2022 to 2026. But before we get started, we'd love to know a little bit more about who's in the room. Launch poll, please. Excellent. It's always great to know who the champions are out in the asset building field. We're excited to have people who are familiar with this space and people who are new to the space. Hopefully you hear something today that inspires you to do work around racial economic equity, racial wealth equity with your communities. And definitely feel free to ask any questions as we go along. We're joined by some really brilliant people who have on the ground knowledge about how to do this work meaningfully in communities. I'm Kat Gogenauer, Director of Racial Wealth Equity Strategy here at Prosperity Now. I'm lead technical assistance designer and provider for this 2-year racial economic equity policy pilot. I've been at Prosperity Now almost 6 years, and I was originally with the Racial Wealth Divide Initiative. We have worked in over 15 cities and 13 states with 60 or more Black and Brown led and serving organizations to do innovative work on the ground. Next slide, please. Since 2021, Prosperity Now doubled down on racial economic equity and justice through our strategic plan. We explicitly focus on centering historically marginalized people, partnering with communities and influential stakeholders, lifting up promising systems-oriented solutions, incubating and evaluating grassroots solutions, and amplifying and sharing those solutions for policy change and to secure progress, transformational narrative, and systems change. So before we turn it over to our panelists, I'm gonna set the stage, give a little bit of context about the project and overview, and then we'll talk with the content experts about who, why, what, and how they've done this work. Next slide, please. In 2021, the Kresge Foundation partnered with Prosperity Now to engage high-impact organizations to turn theory into practice. Prosperity Now is a think and do tank. We like to activate and help people operationalize and implement upstream solutions by leveraging the knowledge, in this case, of the next generation technical assistance, social economic mobility technical assistance, and adding a racial economic equity, racial wealth equity focus. The goal of this work is to work with people most affected to understand the barriers and challenges, take on the challenges as an organization to move beyond products and services and programs, as our groups say, Band-Aids, right? To think about changing the systemic and structural root causes of predictable, preventable racial economic inequity and put money in the people's pockets who are furthest from justice. And these brave and dedicated organizations accepted the challenge. The question remains, who to serve? Please launch the next poll question. Or, sorry, next slide. Pardon. So we'll give you a chance to look at a little bit of data from Detroit and Michigan, and then we'll launch the poll question. Thank you. So an equity approach always starts with the data to identify who's furthest from justice. And we created a racial economic equity snapshot tool, which will be launched in the coming weeks. We look at asset poverty, wealth, employment, income, public assistance eligibility, and other economic indicators. So now that you've had a chance to see a little bit about what it looks like on the ground, please launch, oh, sorry. launch the poll now, please.
Unfortunately, I can't reopen the poll after opening it. I apologize because of.
That's fine. Thank you, Noah. We can go to slide 12. So the question was, which racial or ethnic group do we think is most impacted and the furthest from justice? So through this kind of exploration of the data, our organizations looked at their overall population and see in Memphis, African Americans make up 61% of the population, and in Detroit, 77%. And one of our leaders has said, you know, Detroit is known as one of the poorest and blackest cities. Unfortunately, we can see this pattern across the country. So the question then is who to lead change? Who has the power to make change? And as we were looking at the organizations who stepped forward and bravely said yes, we saw that the combined operating budgets of our 7 organizations is $101 million, meaning that they are most situated to really lean in and design solutions with their communities to make an impact. The causes of inequality can range from deindustrialization, white flight, disinvestment, development without protection, low wages, and a high cost of living. But what we know when we look at the data is that there's a low standard of living, there's intergenerational poverty, there's stagnation and a waste of human potential. And we know from a racial equity lens that this is predictable and it is preventable. Next slide, please. So the question is, how do we turn a problem into a challenge that gets us to design solution sets? Our technical assistance leverages research-based design methodologies, such as this Human Insights framework, developed by Pamela Chan, founder of Channel Change and former staff member with the applied research team at Prosperity Now. It's a really great generative and iterative process that allows us to design and discover and test new ways of looking at community and building solutions. We do a shorthand with this: people and policy, participatory process, and progress. And our groups will talk more about this as we move into the panel discussion. Next slide, please. So what this looked like in practice is over these 2 years, groups used data and research. They created profiles. They defined mobility alongside their community members. They looked at the policy landscape. That's how we identified ARPA as a potential lever. They did power mapping, theories of change. They used many different tools to really think about how do they design the change that their community members need to see in the world. Next slide, please. As Joelle laid out, the North Star is racial wealth equity. The pathway to progress for the racial wealth equity strategy team is racial economic equity, that we need to think about where people are, thinking about this continuum that gets us to wealth building, and think about what has caused the challenges that we're facing today. The goal is to change ourselves, our society, and the systems to become transformational rather than transactional, and really to think about an equity approach, which in my shorthand is giving the most to the people furthest from justice the fastest. So in this panel, we'll hear from 3 leaders about their journey, their challenges, and successes. So at this time, without further ado, let's invite our panelists to join, put on their cameras, and we will talk to them about how they plan to use their part of $73.5 million to create racial economic equity in Detroit, Memphis, and beyond. Joining me are Astar Herndon, Partnership Director of Midwest with Up Together, Alyssa Reetfield, Director of Data and Advocacy with COTS, and Eva Mosby, Regional Vice President, Urban Strategies Incorporated. Turn off the, sorry. To start us off, please say a bit about who you are, the importance of your work, and the people and policy your innovative pilot centers. And we'll start with you, Astar.
Thank you so much, Kat. It's been really exciting to engage in this process for the past year, and really appreciate you level setting the dynamic within Detroit. Just to add more context, you know, redlining particularly has black families from federally backed mortgages, and we know that there's home ownership gaps between black families and white families, black families with around 40% and white families upwards of 50 There was also a report done from COVID that there's disparities in Detroit small businesses where they receive less PPP loans. And so as we go to the next slide, please. Sharing more about Up Together in our organization. We are a 20-year-old organization that invests in the ingenuity and entrepreneurship of undervalued communities through amplifying our strength-based approach of community, cash, and choice. We have built direct cash evidence in Detroit since 2014 by providing working families, mostly women, mostly African American and Latino women in Detroit, who have at least 2 children in the household with $3,200 over 2 years. We have learned that cash with no restriction gives family the flexibility to address their most critical needs, like childcare, paying rent, getting reliable transportation, paying off debt, and taking classes. We also have the historical evidence provided from the expansion of the child tax care credit that cut child poverty for Black families. In this past year in Detroit, we provided 13 Black and Brown employees of Black and Brown businesses with $7,000 to participate in a 3-month pilot. We learned in that pilot that participants had 70% had wages under $50,000 with debt around $50,000. They were working multiple jobs, had average children in the home of 2. They also had an associate's degree. And so they shared their recommendations. We can go to the next slide. They shared their recommendations as well as their stressors in their life and their homes, and uplifted guaranteed income, expanding tax credits and baby bonds as recommended direct cash policies that would pivot them toward economic stability. Short term, and based off of their recommendations, they shared that $1,000 a month over 18 months would greatly assist them in achieving their goals. And we want to amplify $10 million of ARPA direct to Detroit families, with the long-term goal of reallocating general funds to families, because we know that poverty is a policy choice. Thank you.
Thank you, Astar. Very astute insights coming from the people you worked closest with in the community. Alyssa, it would be great to hear from you a little bit more about the work COTS has underway.
Yeah, thank you, Kat, and thanks for kicking us off, Astar. Next slide, please. So, like Kat mentioned, my name is Alyssa Rietveld, and I'm the Director of Data and Advocacy at COTS. COTS was founded over 40 years ago to respond to Detroit's growing homelessness crisis, which we know was caused in part by disinvestment and discriminatory policies. Currently, COTS operates an emergency shelter, a supportive housing program, and we have 56 units of affordable housing. Our program framework is called the Passport to Self-Sufficiency, which focuses on coaching, goal setting, and partnerships. And we primarily serve families with children. The majority of our families are Black and extremely low income. To be more specific, more than 80% of our families make less than 30% AMI, which is about $20,000 annually. Next slide, please. Our policy ask is that the Detroit City Council and Mayor Duggan would reallocate $30 million from ARPA to go towards the Detroit Housing Trust Fund. This fund is formally known as the Detroit Affordable Housing Development and Preservation Fund, in case you've heard of it referred that way, but sometimes we shorten it to Detroit Housing Trust Fund. It was established by ordinance with a city funding source, so the primary way that funds get into the Housing Trust Fund is as a percentage of city land sales, recently changed to 40%. And the Housing Trust Fund funds a wide range of activities, such as the creation and preservation of affordable housing, also accessible design modifications or home repair, and more. It's intentionally broad. And the importance, I think, of the Housing Trust Fund, one of the most important parts of it is that 70% of Housing Trust Fund dollars must go towards housing that is affordable at the 30% AMI level. And all of the Housing Trust Fund dollars must go to support those making less than 50% AMI. And so this is important because we know the fund is targeting those who are most in need. I'll stop there for now.
Wonderful. Thank you, Alyssa. It's been great to hear from Astar and Alyssa about the importance of employment and income and housing supports. And we'll turn it over to Eva, who's representing Memphis, the Memphis cohort, to talk a bit more about the good work you all are doing there.
Thank you, and many thanks to the Kresge Foundation and Prosperity Now for affording us this opportunity to share our learning journey. And Urban Strategy is a national non-for-profit organization which keeps families at the center of our results. Our mission is to ensure that all children and families will be stable and thriving. And at Urban Strategy, we have almost 45 years of experience in doing this work. Our work is rooted in racial equity framework that recognize the legacy of systemic racism and cultural oppression that has long served as barrier to our family successes. And we seek to do right by the community that we serve. Our work is grounded in service across 5 pillars. Case management, but we use the word family support because we say our families are not cases, they are families, so we want to support them. Education, health and wellness, economic mobility, and policy and influence. We really want our families to be able to advocate for themselves with that policy influence. We use a place-based strategies and local resources to capitalize on the inherent strength of the community, while concurrently working with developers to create a new physical facilities and amenities that complement the human service system and improve the capacity of existing community system. Our work in 38126, which is the zip code there, which is the poorest zip code in Memphis and in the state of Tennessee. Memphis is 67% African American, and there have been decades of disinvestment in our community. Memphis leaders bring low-wage jobs to our city because they say the cost of living is low. And since the start of the pandemic, the cost of housing has escalated, and there is no longer affordable. The average income for our community is around $16,000, and we want to invest in families to get job training to increase their income. Therefore, we want to provide 20 unemployed families aged 18 to 45 with a stipend of $350 weekly for 9 to 12 months to support their household need during this enrollment in a certification training program that can gain occupational skills. We're asking the state of Tennessee for $1 million for a 1-year pilot. Then we'll go back and ask for additional fund at the conclusion of the pilot. We want to put money in the pockets of the people. Thank you. It's back over to you, Kat.
Thank you so much, Eva. It's really important, I think, to kind of encapsulate what you all have brought forward is, the people that you're serving aren't even at the poverty line, which is generally $21,000, for an individual, up to $24,000 for families. So the work you're doing is really important. And the way that you've articulated how you worked closely with the people furthest from justice is important. We'd love to hear more about this participatory process because all of you have lifted up over the course of these 2 years that it's a new way of doing business, and that you all really recognize that your people are content experts and you also work to compensate the people, which is a very innovative way of thinking about community engagement. Astar, if you wouldn't mind kicking us off again, and we'll have a little bit more of an intimate conversation without the PowerPoint deck at this point.
That sounds good. To share more about our process and how we engage the community, as I shared, we engage 13 Black and Brown employees of Black and Brown businesses. They call themselves the Be the Change cohort. They still meet every other month and provide thought leadership and political strategy to help us build statewide awareness and statewide coalition understanding of how direct cash can be a tool for economic stability and ultimately mobilization and wealth building. We also know that advocacy requires creativity and time, which can be accelerated, right, through cash. It also created a safe space for political education because, again, we want to create the long-term infrastructure and knowledge about how cash can be a tool through different policies that I shared before. Guaranteed income we recognize is the lowest hanging fruit right now, but there are other policy menu that was suggested by the Be the Change cohort, and we know that it's going to take a number of policies and a number of adjustments to provide families with that cash and that economic stability, right, that again moves to mobilization. I think one of the challenges is, of course, is sustaining and expanding the funding so that we have more opportunities to give to families, as well as creating more policy pilots, right, so that we can measure its long-term impact. I will leave it there. Thank you.
Thank you so much, Astar. And one of the wonderful learnings from your work, I think, is really, the energy that community brings when they are engaged in a different way than just being an end user, consumer. Eva is really good about talking about different ways of talking about our populations. But yeah, people closest to the problem, they're ready to lean in. And so it's really wonderful that you're able to lift that up. Alyssa, how about for you? I know you all did a big effort with regard to how COTS operates.
Yeah, thank you, Kat. So I'll start going back to talking about the Detroit Housing Trust Fund. I'll start by saying that COTS has been involved in a coalition, the Housing Trust Fund Coalition, for several years now. So this coalition is made up of COTS and then 4 other like-minded community organizations in Detroit. So this is an example of a way we've been engaged in advocacy. However, recently and through this cohort work, we've really been developing a more specific advocacy framework. And in doing so, we are prioritizing and centering our participant families in that process. So to help do that, we launched a political advocacy council. And this council is currently made up of 11 current and former COTS participants. And this group helped us establish what our advocacy priorities would be for the year. We have regular council meetings, and the goal is that the council would be active in influencing policy. And something that we're continuing to learn is how we can bring these participant stories to advocacy conversations in a way that is empowering and not tokenizing or even re-traumatizing. And we're also mindful of stereotypes and how we can disrupt those stereotypes with facts. And part of being trauma informed means that we're really being intentional about supporting participants through this work. So an example of that would be providing training, such as a communications training, and also bringing data to the table to put their individual stories into a broader context, into a larger context. And then the last thing I'll say is we view our participants as expert consultants, and like Kat mentioned earlier in the call, we compensate them as such. Right now, we are paying $25 per hour to the Advocacy Council members for their time at meetings, trainings, or events.
Wonderful. So many ways to creatively compensate people. It's really exciting to hear how you all are thinking about your communities, and I'm just very inspired to think about what their life trajectories look like after this empowerment, power building process, and the fact that you are base building as a constituent part of how you're doing systems change and narrative change. Eva, it would be great to hear a little bit from you all about your learning journey with regard to how your project started out and then how it ended up when you all started engaging the people closest to the problem.
In Memphis, thank you, Kat. In Memphis, we really had a learning journey because initially we said we're going to do some research on the TAPE test. Let's disrupt that TAPE test, which is a comprehensive assessment used to assess the skill and knowledge of the adult learners. And typically, you find the WIA, they will give a skills test to the individuals. And so that's one of the things we had heard years ago. Hey, we need to do away with the TAPE test. And then we decided to focus on transportation because you always hear transportation is a barrier for individuals. Then finally we said, hey, let's pivot. Let's survey 60 families to determine what's most important for them. And during this discovery and design phase, many of the individuals say, I want to participate in a training if I'm giving a stipend. It will afford me the opportunity to assist with my rent, my utilities, childcare if it's needed, food, whatever those needs may be, long as there was no restriction on it, we'll be able to go to a training program. Most of them said they had attended or attempted to attend training programs in the past. They had to drop out because they had to get a job just so they can meet their day-to-day needs. So we felt it was really important to really advocate for the families and really work with them, and how do we really get that money in their pockets so they can go through a training and have an opportunity at some living wage jobs, and so they can be successful. So thank you, Kat.
No problem. And as you all are talking, I am very interested if you could say a little bit about the cost of living in Detroit and Memphis. I think it's interesting to kind of peg to what are we trying to get people to if we kind of know where they're starting out, which is below the poverty line. What is the hope for this infusion of resources, or in bringing in more funders from the private sector, public sector, philanthropy, other nonprofits to actually help your people on this economic mobility journey?
And I can go with Memphis, and we do understand that the cost of living is over $30,000. Really, it's closer to $50,000 if you really want to know the truth about what's that cost of living for someone to live comfortably. And really working with other projects in the areas and knowing there's some opportunities. We have a company that's moving really in the area in West Memphis, in West Memphis, that will, in western part of Memphis, because people think about West Memphis, Arkansas, but I'm talking about West Tennessee, that they can have some opportunity with a Ford company where they will build their electric cars, and these will be really good paying jobs. So we want to upskill our families so they can have an opportunity at these great paying jobs.
Wonderful. Astar or Alyssa, would you like to speak to Detroit before we go to our last scripted question? We're starting to get questions in the chat, so we'll have an opportunity to engage with the community as well.
So the cost of living for Detroit is well over $60,000, I believe. Alyssa can help me with that. But as I said, in the information that we received before from our members, 70% are making around $50,000 with a household of 3. So that's the information that we've been able to obtain through our platform.
Right. So the lift is large. I think that's one of the questions in thinking about, you know, the $880 million that exists at the Michigan level or the Tennessee level. You know, is this enough? How big is your ask, right, with regard to what you're trying to carve out from existing dollars that go through 2026? And then trying to think about what is the actual investment amount needed to move the families you're piloting with, or families more broadly, to get to what Joelle has lifted up, you know, sustainable wealth over time, so that people aren't consistently coming back in our doors. They're able to maintain and sustain over time. So I think, you know, as we think about forward marching on and what's next, it would be great to hear from each of you a little bit about the momentum you have as we turn from doing our internal incubation process to really getting out in your ecosystem, finding champions, committees to be a part of, doing advocacy at the state, municipal, federal level. Where is your work today, and what's your vision for 2023 and beyond? Astar, would you like to kick us off?
Sure, I can kick us off. So as I said, Up Together is a nonprofit and a platform, and have been providing cash for a while in Detroit. And we're really excited to leverage our findings in partnership with the members that we've engaged with. But one of the missing gaps was community understanding the larger opportunity that cash can have for the stabilization of our communities, right? Whether it is, I saw someone in the chat asking about eviction prevention. You know, one of the top usages of cash is rent that we've learned. And so cash is a tool to be able to provide that stabilization, and particularly coupled with choice, because we know that families have goals. They know how to use and what to use those resources for. They just don't have the resources. And as I said before, they're working multiple jobs, and so their time is absorbed with working and not necessarily to and maxed out, right, for future earnings that provide that stability. But one of the successes that we've had by orienting our work in membership and the community is that we've grown the coalition to over 50 organizations in Detroit. We're also working with the city of Detroit. There was an allocation of $3 million of ARPA dollars so far. As I said, our ultimate goal is to allocate $10 million. And there are conversations of a pilot that provides $500 for 24 months. Again, that's under the recommended amount from the community. And so we want to, whether it's leveraging philanthropic dollars or adding additional ARPA dollars, as I said, our goal is 10 million. We want to be able to pilot different amounts to really, to get to Kat's point, right, of closing those wage gaps and providing the stability and potentially wealth building within Detroit.
Wonderful. Thank you, Astar. And yeah, thank you for weaving in a little bit about eviction prevention. Alyssa, I know that your organization really focuses on all aspects of housing. I don't know if there's anything you want to speak to around that, but also, you know, the potential you see with this housing trust fund and, you know, being able, I think you had mentioned it in a former conversation that none of the ARPA dollars at this moment had been set aside for housing. So if you could speak a little bit more to that, it would be helpful.
Yeah. So in regards to ARPA and affordable housing, none has been specifically allocated to the creation or preservation of affordable housing. And so we think that using some of those ARPA funds for the Housing Trust Fund is a great way to not only support affordable housing, but doing so to target those who are most in need. We have had some recent wins regarding the Housing Trust Fund. Just this week, we found out that of the Detroit city budget, 1.8 million will be going to the Housing Trust Fund, but you know that's not quite close enough to our ask for a $30 million injection. So we still hope that that 30 million from ARPA could join the other money in the Housing Trust Fund. We do have a champion at the Detroit City Council President Mary Sheffield. She's a huge proponent of the Housing Trust Fund, which is great. We actually have a public town hall meeting next week to talk about the Housing Trust Fund, and that meeting is hosted in part by Mary Sheffield as well as the Housing Trust Fund Coalition that CATS is part of. So yeah, really we haven't had the success that we have imagined yet of the ARPA funding, but some money is going into that fund.
Excellent. Yeah. And, you know, the truth about housing, I think all of the data showed for everyone, it's the biggest cost burden for low income people. People are spending 70, 90% of their income. And as we know, HUD is really trying to think about, you know, not expending more than 30% of income. So, you know, the question is, well, we don't have kind of those protections, or, you know, if people exceed these thresholds, there isn't kind of a fail safe in the system. So how do grassroots organizations, communities, community-based organizations really step in that gap to amplify and elevate the need, but also to really explain that, you know, these kind of extravagant expenses for basic needs are stymieing families' ability to, you know, do things that would be generative to Eva's point, you know, being able to have choice with regard to employment, that people are overworked and underpaid, that people have invested in education, so they likely have, you know, student loan debt. There are all of these other factors that are holding families in place. And when we think about intergenerational disadvantage or advantage, we have an auspicious moment to really disrupt the cycle. And so it's really exciting to hear how you all are thinking about the work and what you think could be next. And Eva, it would be great to hear, you know, how you all are leveraging workforce development alongside housing, because you also focus significantly on housing, to think about stabilizing families and getting them on a pathway to economic mobility.
Thank you. And with that, the City of Memphis and the Shelby County government, they teamed together to have funds for rental and utility assistance, because majority of the families we serve, they are in public housing or a mixed income development. And so therefore, they allowed us to really go into the portal to assist the resident, go into that portal to keep them from losing their housing. So which was a huge win for us. How do we provide them with those opportunities? And really with providing the family with that family support, we knew when they were in at risk of being eviction, really talking with the landlords and the property management, it really helped us to help them. And so we're really appreciative of that. even with utilities, because we know with HUD, your utilities cannot be off more than a week. And so therefore, we really advocate for that. If you're losing your utilities, let us know, bring that in so we can really go into that portal. But that money has been exhausted. So we're still working with how do we get with the other local nonprofit like MIFA to really assist our families when they're there at the stretch. They're really having a difficult time. And so I just want to share a little bit about our successes too. We've been very successful meeting with our legislators at every level of government. We met with local government, state government, and federal government, and really being able to share with the elected officials rewarding for urban strategies, because our legislators, they ask good questions about our pilot, which really made us say, hey, you've really done your due diligence, because we could answer every question. We met with the city of Memphis mayor, and we requested $1 million for him to support that. And of course, we know it's off the funding cycle, but we'll be right back there because he's gearing up now for the budget in July. So we'll be there asking for this money again. In fact, I had a conversation last night about this. We'll be right back asking for this money. We also met with 2 state representatives and a state senator and the governor's chief of staff, to share our proposal. We did our advocacy work in Washington, D.C., and we know we're not lobbyists, so we can't lobby our federal, but we can really share the work that we're doing. So we're very hopeful that we'll receive funding from the local and from the state, and really pushing what are some of those earmarks the federal government may have that we can tap in some of those earmarks as well. And we know our families deserve to be upskilled and given an opportunity to have these living wage jobs. So we're excited about this. And one thing I want to share too, that we started out as a cohort. We was going to have an event. The weather prevented us from doing that. And then we had another event. It conflicted with our state legislator. So we went to Nashville to advocate on the Hill. And so I thought that was really successful for us to actually get in front of them. We were prepared to share our ask. And just even before we shared our ask with Kat, we said, how do we go in and just share this information with them? And it was well received. So I'm really appreciative how this has allowed urban strategy as a whole to really get in front of legislators that make that ask for money. And then too, I know we only asked for $1 million. I'm saying only $1 million because we want to prove that what is the data saying? Because we are a data-driven organization, we want to show what this data is saying so we can go in and ask for more zeros behind that $1 million. So thank you.
Thank you, Eva. I love when people add zeros. I mean, some of the research around African Americans in the United States says, $14 to $17 trillion to try to close some of the gap of the past, rectify some of the contemporary policy challenges, and shorten this 228, 42-year forecast of when we could see equity, parity, justice. So, there is no ask too big, in my opinion, when we are advocating. And I think you made also a very important distinction about advocacy versus lobbying. For nonprofits, there's a gray area. And so, there's a question in the chat about, what advocacy tools are missing, or how did you all get in position to do the work? Before we go to that, though, I think, Up Together, you have a very interesting story about how you all drew down CARES dollars and ARPA dollars already during the pandemic, and we're able to allocate those. I don't know if you might want to say a little bit more about your platform and how you had an initial ask and then you added a zero, and how you were able to get that money out, which undergirds your ability to go back and then also think about how to pair public sector and philanthropic dollars.
Yeah, and I really encourage folks to look back at the slides because I list out the dollars that have gone out in Detroit, specifically as Kat mentioned, through CARES dollars, and I believe the cumulative is $16 million. That's across the state of Michigan, with around, I believe, $5 or $6 million specifically going out in Detroit. And so all the evidence that I mentioned, especially about dollars for families using it for critical needs, rent, childcare, that was all evidence that came from the platform engagement. I'll just reiterate that we are a nonprofit and a platform that believes in community, cash, and choice. We believe that the community, undervalued communities, have resources, they have networks that are sharing information, but they don't have the actual cash, right? And unrestricted cash, particularly. I see the question about financial literacy, and our pillar is that there should not be any restrictions. And the evidence that has been proven and garnered from our platform is that restrictions actually prevent families from addressing those critical needs at that particular time, right? And as I said before, these are working folk, working several jobs with children. And so I do think that we have to reconsider, and the evidence that we've been building on the platform shows to the contrary, right? That folks need more training, that they're actually kind of educated. Associate's degree was the aggregate of education that folks have, right? But again, don't have access to capital and are transient in work, right? You know, the full-time job may be providing a little bit of healthcare, but it's not providing those livable wages, right? And so that direct cash has really been an injection point. And yes, we are building off of those CARES dollars information that we've garnered from our platform and the information that we've garnered from the 13 Black and Brown employees of Black and Brown businesses. I think that's a value add as an organization that we're able, through engaging the community, to garner actual data, right, that colors quantitative and qualitative analysis of folks' lives, and through long-term investment. I think what we're missing is the dollars, right? Because as I said before, advocacy requires creativity and time. And the description of the members that we're connecting to is they don't have time to creatively think and construct policies. But when they were asked, they listed, you know, guaranteed income, expansive tax code, and baby bonds, right, as the priority. And we're astute to say that guaranteed income is popular right now, but expansive tax code may work statewide, right? But they just haven't been asked and provided significant wages, right, to really have a fuller understanding how policies impact working folks, and particularly Black and Brown people. So it's the merging of the data, the narrative changing information to change those tools. And we believe that that's the long-term infrastructure for a true change in Detroit that reallocates general dollars.
Excellent, Astar. And Alyssa, that brings me to the work you all are doing. You know, the question about financial literacy, you all use a impasse model, the economic mobility pathway model, as part of your work. So you kind of have built into your service delivery a way to track and assess the way people are building income and assets, also thinking about it from a trauma-informed perspective. And just to bring over a bit of what Astar is saying, you know, one of the things about the deficiency frame we ascribe to people living in poverty when we blame the victim of systemic oppression is that they're unmotivated, uneducated. But what we know about trauma is it creates a response in our body that overrides our prefrontal cortex, right? It's very hard to think about what you would want to do in the future when you're concerned about the moment that you're in, the crisis that we're in. And so, yeah, I think it would be interesting if you could share a little bit more about how you all have been thinking really intentionally and leveraging work you were already doing to think about how you move people on this mobility pathway.
Yeah, thank you, Kat. Our passport to self-sufficiency framework that Kat alluded to, one of our domains is finances. And so we do offer, so for the participants in the council, they have either been formally in coaching or still are being coached. And so they are receiving, you know, coaching, not just about finances, but about, you know, all of our five domains. So the financial literacy, maybe that's not necessarily the term that we use, but they are, you know, in financial coaching. And Kat also alluded to the fact that we do track their income and work with them to set financial goals. So yeah, I guess, you know, with the cash stipend and their coaching, I think together that does help them get towards the economic mobility. That is our overall goal of coaching.
Thank you for that. I think there's an interesting question about you all are doing advocacy on the ground in real time right now. What kind of tools do you think are missing? We had Vanicure with Prosperity Now's network team who has built a policy advocacy boot camp. We worked with our policy team, Alejandra Montaño-Boyer and Lauren Belor, but this field is burgeoning, right? We know there are not a lot of ways to help people furthest from justice to actually become policy advocates, to lean into the work. So as you all have kind of stood in the gap, adapted, adopted, and modified tools, what would you love to see beyond being heard as the best strategy to actually affecting change? Because I do want to say, is it that the tools are missing, or is it the will is missing by the system to actually hear and take up the evidence base and the information we bring forward to actually enact that change? Is it more about us advocating and having the right tools, or is it also a need for a change of mindset and behavior in the system? Both and, I'm sure, but who might want to speak to, what was powerful and what was perhaps missing as you moved out into the community to talk about your work and advocate for change?
I'll take a stab at that. Based on the work that we've been doing with Urban Strategy as a system, I share we are a national organization, so we've always done some advocacy work, but we didn't have it as detailed as this, and so which really gave me that sense of, okay, hey, how do you have that ask? We would do advocacy work, but I didn't see where there was an ask. And so this really uplifted that for me. I know that we were heard, but then what's that feedback loop? You continue to meet with the legislators and the powers that be, so they're hearing you, and we continue to follow up. So when is it too much to follow up with one to ask about the money? We're going to continue to ask. But also, I think by doing this work, it has allowed us to do what we're working with this organization. We've named it More for Memphis. We said, hey, economic mobility, our families deserve more, so we want more for Memphis. And with that, and I won't name the philanthropy, they're ready to infuse $50 million into our community to uplift that economic mobility there with another $50 million match. So to me, all of this is really tying into the work that we're doing. So all of it sort of collided at the same time. And I'm thankful that we have this background here to help us really advocate for the money there.
Thank you, Eva. Yeah, very exciting. Once you get the ball rolling, it's interesting to see who wants to be a part of the solution. Even if historically they might have been, identified in some of the causal analysis we did, it's a different moment since the racial reckoning. In particular, I think the pandemic helped us understand, the economic insecurity can drive poor health outcomes. So there's this health-wealth connection, right? But I also hear organizations also need time and resources to be able to do this work. I mean, if there's an advocacy tool missing, I guess that would be it, direct unrestricted funding to actually do this work, perhaps some changes to how nonprofits are designated with regard to advocacy work and how much time they can spend on that. I also heard from other folks the need for dedicated staff that can do this beyond doing direct service and the work of a nonprofit. But Astar or Alyssa, anything that was missing from you, or an aha for you, or something that's really promising as you think about how this work is going to grow over time?
I can jump in. When I was thinking about the Q&A question that was submitted about like a tool that might be missing, I think mostly that it seems like legislators maybe sometimes are interested in hearing from community members about the specific issue or the recommendation on the policy, but it can be really intimidating to talk to a policymaker, especially if it's about something that was traumatic or, so personal to you, something that you're maybe even still going through. So I think from Katza's perspective with our advocacy council too, I think a lot about kind of that training of how to deliver, your experience, but tying it to data and tying it to a larger context to have the most impact. Because I think it can be re-traumatizing to lay it all out there, especially to someone that you don't necessarily know, and it can be kind of scary for anyone. So I think that part of it, of course, that means more funding. To your point, Kat, just giving our participants enough space to practice and get comfortable and make sure they have all the tools that they need. And then, of course, like you mentioned, to making sure the system is ready and has their ears open and their minds open to what ideas are out there.
Great, thank you, Alyssa. And yeah, Star, if you want to close us out on this amazing panel, and yeah, just give any thoughts about AHA or what was missing for you.
Thank you. And yes, of course, what's missing is long-term investment. I just want to say that one final time because you know, when we think about that safe community and of space of political education, of information sharing, of shared experience, right? And that's what we're seeing within the Be the Change cohort meetings. That is going to require, again, that creativity and time, right, to incorporate your lived experience and realize that it's not, you know, just me and I need to work harder, but that there are actual systems, right, that are creating these dynamics, and that's actually, you know, created a safe space, and so that needs to be invested in. And I think, again, when we talk about reallocation of dollars and programming and how we think about undervalued communities, that's the hill that we're climbing as an organization. You know, as I shared, we collect information, it's optional. We are not using that as contingent for the funds. And I think, again, you know, building that understanding that undervalued communities, again, just need resources, and that it is really unkind to burden an individual family or worker with the role of developing their communities, but also not resource them, right, with disposable income to be able to inject in their community, right? And so it is correct that COVID has created a wonderful opportunity and learning, and we have to dispel notions so that we can create new systems.
And on that note, thank you all for joining today. I'm going to turn it back over to our network team. I think the final thought is time, talent, and treasure, work, wealth, and wisdom, however we say it. Thank you all for joining today. It's been a pleasure.
Thank you, Kat, and our panelists. So much learning to do today. We're moving on to next steps and wrap up. Visit our advocacy center to stay up to date with advocacy efforts. Please complete the exit survey, sign up for one of our networks, and let us know your suggestions for future call topics. Plug into the Prosperity Now community and take action with Prosperity Now campaigns with the homeownership, consumer protections, financial security, and Turn It Right Side Up tax campaign. Thank you. Have a good day, and please complete our survey at the end.
Thank you, everyone.